Namaste.
This is a beautiful report I want to show to you. Here on the left side, you are seeing a 65-year-old male patient who is suffering from diabetes, but he is doing very good exercise and diet and maintaining. They have started insulin for him, I don't know why. On the right side, there is one more patient. On the left side, the patient was having fasting blood sugar 120, but his fasting insulin is only 6. Can you observe this? But the HbA1c is more than 8.2. He is stamped as diabetic and he was kept on insulin and multiple drugs. Whereas this on the right side is a young boy, 22-year-old. His blood sugar is normal 80, but he is consuming 33 units of insulin and post-lunch insulin is 102. That shows he is consuming lot of insulin, and because of that his sugar is under control. What all he is eating is getting converted into fat and is stored around the abdomen. He is weighing 120 kgs now. The waist circumference is more than 42 inches. Out of these two, who will has a high risk for high mortality for cardiac events or cancers or death? Higher on the younger boy, 22 years, not the 65-year-old. We are dumping patients unnecessarily thinking that HbA1c is high and blood sugar high, but we are not doing fasting insulin test. Fasting and post-lunch insulin will give you a very good idea. People who are having high insulin resistance is a single risk factor for coronary artery disease. Fasting insulin is high, more than 16 units in India, and HOMA IR, if the fasting insulin to fasting blood sugar divided by 405, if it is more than 2, it indicates insulin resistance. Singly, one event which will tell you who will get a heart attack is high insulin resistance. Second important is waist circumference. Waist circumference more than 85 cm or 33 inches is a single risk factor for both heart attacks and diabetes. So this is a very, very important slide that I want to show to everyone how to interpret a report by taking a HOMA fasting insulin test. Fasting insulin to fasting blood sugar divided by 405, more than 2, it indicates insulin resistance. Young boy, 22 years, non-diabetic, cholesterol normal, but his central obesity is very high, waist circumference more than 100 centimeters and weighing about 120 kgs. There is a well-controlled diabetic patient, but he was dumped as diabetic, he was kept on insulin and he was kept on multiple drugs. Because of that, fasting blood sugar is very high. Just based on fasting blood sugar or HbA1c, don't add any drug. If you have any doubt, kindly ask me. I am Dr. M Surendra Nehru MD physician. My number is 996 3721 999. I want to create an awareness about HOMA IR and Quit India Diabetes and Obesity movement. Kindly join. Thank you.